This is Focus on Your Health on the KJAZ Radio Network. It's brought to you by the good folks at Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG LaFredo, and today's program is about substance abuse. We're talking about the abuse of prescription medication and the use of illegal drugs as well. Every week, I talk with members of the medical community here, and they've made it clear that we're dealing with a serious problem in the U.S. and in Mohave County in particular. It's tough to give a sense of the depth of that problem, particularly in a half-hour radio program, but I have some great guests today, and what they have to say is pretty powerful stuff. I will say before we go on that because of the serious nature of today's show, there are a few moments that may be difficult for listeners of a delicate constitution. It's nothing gratuitous, and it is real. I'm just giving notice. So if this offends you, you can change the station for a few minutes and listen to some cheesy pop songs. But I hope you'll stick around. My first guest is Dr. Sarah Knievel of Mohave Pain Management. Dr. Knievel, hi and welcome.
Hello.
I came in to do a show with you not too long ago, and when I was here, you told me about this new project that you've gotten involved in, the Mohave Substance Abuse Team, or MSTEPP.
Mm-hmm.
Can you tell me a little bit about that?
MSTEPP started approximately, I believe it's over a year now. The state of Arizona became aware of our significant issue with substance abuse and people dying from controlled substances, such as benzodiazepines, narcotics, and whatnot. And so actually someone came up from Phoenix. Her name is Shanna Malone, and she hosted, along with other individuals, a town hall meeting to introduce awareness. And from that group, there were physicians, pharmacists, other city council members, police, law enforcement, patients. This coalition was created, and we've been meeting monthly since then to kind of address this massive problem. That's nationwide, but really focusing on Mohave County.
So when you guys are talking at these meetings and you're trying to come up with strategies to curb the abuse of controlled substances, what kind of strategies do you put into play?
There's strategies regarding prescription dispensing, education of providers, and using different tools. Some are statewide tools, some are tools that I've implemented within our own hospital here, such as controlled substance agreements, drug testing. That's one part of it, if we can control the outflow of the medication. Law enforcement has been involved in researching and following up on cases with individuals that have suffered or had issues with controlled substances. There's a large component of our group that focuses on educating school-age children, and there's also a large component that we try to focus on with community awareness. We've done a lot with collecting controlled substances, so there's drop boxes at different locations. The one that's closest to us here is at the police station, just right on the inside door. It's like a mailbox, just drop them off, because you can't return controlled substances to the pharmacy, unfortunately. It's something that has to be disposed of in that fashion. So there's many things that we do.
The last time you and I talked, you were saying that it's become common for young people, whereas maybe before they would try to find some older brother or something to get them alcohol. Now they're still doing that, but they're also mixing that with prescription medication.
That's correct, and there's a lot of alarming statistics that have come out of the CDC recently, and specifically in Mohave County, children ages 12 and up are more likely to try a pain pill from their parents' drug cabinet than they would alcohol, which is extremely concerning because it's children's response and people's response to these medications, especially when they're mixed with other substances, can be much greater than just the substance by themselves. That's why more people are dying. It's because there's an accumulative effect when you take a pain pill with another depressant like alcohol or another type of medication like that. So the pills are out there and the kids are comfortable trying them.
Yeah.
And that's one of the biggest problems that we're faced with trying to avoid overdoses.
Mm-hmm. I can almost imagine the situation because this is something that came from a pharmacy and it's got, some official stamp on it. And
my doctor gave it to me.
Yeah,
it must
what
be
could
safe,
go wrong, right? Yeah.
Yeah, that makes it even more scary. It's very unfortunate.
Okay. Well, Dr. Sarah Knievel, thank you so much for your efforts in this, and thanks for talking to me.
Thank you very much for having me.
When we started putting together this program, I spoke with Dr. Knievel, of course, and also with Patricia Jacques. She's with MSTEPP, Mohave Substance Abuse Treatment and Education Prevention Partnership. She'll be joining us toward the end of the program. They both told me, you need to speak with Jaimie Valdivia. So here she is. Hi, Jaimie.
Hello, how are you?
Great, thank you. You're out in California, right? What city are you in?
I'm in Pomona, California.
But you have a connection back here with Mohave County, right?
That is correct. I was raised in Lake Havasu City, Arizona.
And you still have family out here?
I do. I have my mother and my father.
When we started planning this show, Patricia Jacques sent me your name and she said, I really need to get in touch with you. She said they hosted an event earlier this year and you were there as the keynote speaker. So Jaimie, why is this cause so important to you?
This cause is very important to me because I lost my baby sister, Nicole, last year to drugs, unfortunately. She was only 23 years of age at the time.
Oh, boy. Well, I'm really sorry to hear that. How did Nicole become involved with drugs?
She actually started when she was 13 or 14 years old. She started, unfortunately, with marijuana, and it led to getting involved into taking pills, prescription drugs. They basically would go, her and her friends, to, whoever's parents' medicine cabinet and take a handful of whatever happened to be in there. They glamorized it and had these parties, named it Skittle parties, not the candy.
Was that their term, Skittle parties, or is that something that young people know all around?
It's actually the new term for the kids of this day and age. That's what they call it, is a Skittle party. Wow. You go and you put different prescriptions into a bowl. Instead of, having chips and dip on the table, you're getting your pick of whatever drug it could be. And you just take it, not even knowing. And, of course, what do they take it with? With alcohol.
But did you know that Nicole was getting into trouble at that point?
No, I didn't. I wish I had, but I had moved back to California when I was 16.
Did the family in Arizona know?
Yes, they did. My parents did know part of it. I don't believe that at that particular time they knew what Skittle parties were, right. But they didn't know that she was having an issue with illegal drugs.
Why do you suppose they didn't tell you what was going on with your sister?
I truly believe that they were in denial about it. They didn't want it to be that maybe they failed as parents. They were divorced. Our family ended up breaking up, right. Which is also a reason why I moved back to California.
There was a significant age difference between you and Nicole, right?
That is correct, almost 10 years.
Right.
Yes, she was my baby sister. She was also my best friend, but because of the age gap, I was also like a mother figure to her.
Yeah. Tell me how it was then that you finally discovered that she was getting into drugs.
Well, I ended up getting a phone call, and that was on December 23rd of 2011. This was coming from one of her good friends. She contacted me saying that she was very worried about my sister, and she had tried to go to my parents and talk to them, and they basically, shoved her off and said, we'll take care of it. And then when approached again about it, the issue, they were, just mind your business, we've got it under control.
Yeah.
When she saw that wasn't happening, she contacted me and brought it to my attention. I have to admit, I did question her. Well, how do you know this? Are you sure?
Right.
No way, because we stereotype what people look like, and that didn't, look like my sister at all. I couldn't believe it. So I did question, and she said, well, because I've done them with her. And I knew right then.
And at that point, it had progressed beyond even the prescription medication, right?
That is correct. When the phone call was made to me at that time, my sister was highly involved with heroin.
So here it is a couple of days before Christmas, and you got that awful phone call. And what was your next step?
I actually went into the kitchen and looked at my husband, and I said, I'm going to Lake Havasu, and I'm going to bring my sister back. And I drove out there with the intent that if I had to kidnap her, stuff her in the trunk of the car, so forth, I was not leaving that town without her.
Right.
I had never been in trouble with the law, but it was worth breaking for that particular reason.
And describe the situation when you found her.
Well, it was roughly around 2:30 in the morning. I pulled up to a house. She didn't live there, but it was a person that she associated with at the time. And I was very, very scared. I had no idea what I was going to walk into. I had my friend on the phone in my pocket, being I'm alone, and it's the middle of the night. And I just knew that I had to be strong. I was there for a reason. I walked up and knocked on the door, and the door opened up. And it was a gentleman. I had met him on a previous occasion. Mind you, I didn't know that this was actually even his home. He was looking at me with uncertainty that, do I know her from somewhere? Kind of not sure, and obviously who'd be knocking on my door at this time of the night.
Right.
And I said, yeah, I'm Nicole's sister. I said, I know she's here. He said, let me go get her, and he went to go close the door. And I put my foot in the door.
Yeah.
And I said, no. No one's closing any doors. And at that time, another female came running out of the back bedroom. Behind her then came out my sister, kind of a deer in headlights look. So I said, we're leaving, Nicole, and I'm not leaving Lake Havasu without you.
We'll be back in just a moment. This is Focus on Your Health on the KJazz Radio Network. Welcome back to Focus on Your Health here on the KJazz Radio Network. This week we're talking about substance abuse in Mohave County. My guest is Jaimie Valdivia. She's on the phone from Pomona, California. And Jaimie, before the break you were talking about your sister Nicole and the drug problem she had developed in Lake Havasu City. And you drove up to Havasu and you said you'd kidnap her if you had to. But it didn't come to that, right? She agreed to go back to LA with you.
That is correct. She did. She stayed with me for about 4 months.
And it was at that point you realized that her drug problem went pretty deep.
Yes, definitely. I couldn't believe what I was hearing. This little girl that, I loved and adored, and I'm looking at, and she looks like a healthy individual, was doing this, and the severity of it. She was a terrific student, always on honor roll. She was involved in sports. She graduated high school. She worked. She did it all. She, was very inspired. She was even going to join the Air Force at the time.
She had graduated and she was accepted to go to the Air Force even with some of the trouble that she had gotten into?
Yes, that is correct. Going back to, the trouble she had gotten into was, at that time was able to be overseen because of her age, and it wasn't that, severe. But 3 days before she was to leave, she got in trouble and got arrested again. And at that time, she was, no longer able to go to the Air Force.
Right.
She ended up getting very, very sad, depressed. She allowed it to eat at herself, and just a way to escape it. She got into using the pills again, getting back onto, harder drugs, and sadly from methadone pills into heroin.
So, Jaimie, here's what I don't really get. I mean, you said Nicole was a smart kid and she had a lot of interests. What do you think took her down this dark road?
I actually never got a straight answer from my sister. I can only give you what is my opinion from what my heart is telling me.
Yeah.
My sister was, more attracted to females than males. And even though our family was very accepting about it, she, you have the society and so forth that you have an image to hold up. And I believe that did bother her. And there had to have been some other demons and other sadness that she had that just, she kept bottled up that she wouldn't share with anyone. I'm sure that the divorce, even though she never expressed it, also played a part. Me leaving also because she looked up to me, even though I was still there and she would visit with me in California all the time. She always strived to be the best. And then especially after, not being able to go into the Air Force, I believe she felt that she really let everyone down.
Yeah.
I truly do.
So she had stayed with you, and somehow she ended up back in Lake Havasu City, right?
That is correct. She went back for work, and I was not comfortable with it, to be honest with you. Yes, when she had come out here, and she was clean, and also doing the classes.
Yeah, obviously getting a lot of support from you at home, too.
Correct.
Yeah.
But, she was also a very weak individual when it came to saying no, and the pressure from other people, would really get to her. So I knew that it was a possibility, and she did go back to Arizona, and, sadly, she did relapse.
And I guess that brings us to June of 2013, and that's when you lost her, right?
That is correct. It was the morning of Father's Day.
Mm.
I had actually had a conversation with her 3 weeks before that happened. She had told me, I made the biggest mistake of coming back to Lake Havasu. And she asked me if she could come back to California. I have to say that I've never heard a tremble in my sister's voice or it cracking, and to hear that, I knew that it was deep. She was frightened, and I told her, I said yes. She informed me that she couldn't. She had to take care of a couple of things, at the moment, but she would, come as soon as she was able to.
Right.
And she didn't get that chance, sadly. It was 3 weeks later, that we lost her.
Yeah, this is the toughest part of the story, but can you describe what happened the day you found out?
She had actually worked that evening, a new job, and, was sore and so forth from doing a different type of line of work. She got into the bathtub at a hotel that her and my mother were staying at the time. It was, on the outskirts of Havasu, run down, small, one bedroom. My mother went out to do some laundry, and after returning about 15 minutes later, she called out for my sister, Nicole, and my sister didn't answer. So then she knocked on the door to, make a louder noise, and there was no response. At that time, my mother engaged in, breaking into the door, and was able to pry it open and found my sister in the bathtub, submerged under the water with foam and blood coming out of her mouth and her nose. She then pulled my sister out and brought her out into the room and laid her on the floor and tried to administer CPR while she was yelling out for someone to call 911 because there was not even any phones in these hotel rooms. The ambulance arrived on scene and transported her to the hospital. She still was unresponsive at the time, and after 20 minutes of being worked on at the hospital, they were able to bring a pulse back. She was then hooked up to life support. They did their testing on her, and found that there was no brain activity, no organ activity whatsoever. And even on full life support, she continued to code. It was at 4:43 when they asked my mother, would you like us to code her again? And my mother made that decision to have them not resuscitate her and to go ahead and shut the machines off, which she was pronounced dead at 4:44.
And she was gone at 23 years of age.
23 years of age.
You know, it hasn't been that long since you lost your sister. It's been, just over a year. And, obviously you can't go back. You can't change what happened. How do you begin to come to terms with this? Are you angry about it?
I'm not going to sit here and say I'm not angry. Of course I'm angry. I'm angry at a lot of things. I'm angry with myself. I question, did I do everything that I could? I'm angry with my parents. Why didn't they do something about it sooner? I'm angry with my sister. But that anger is not going to help me, and it's definitely not going to change anything or bring her back. So the best way that I can cope with it is, continue to reach out to other individuals. And even if it's just one person at a time, helping them, saving them and their family, it means just so much to me. I don't want anyone else to have to ever deal with this pain.
Jaimie Valdivia, I am so sorry for your loss, and I really appreciate that you told us the story here today.
Thank you for having me. I really appreciate it.
My next guest is Patricia Jacques. She's a director with MSTEPP, which is the Mohave Substance Abuse Treatment and Education Prevention Partnership. Hi, Patricia. How are you?
I am well, thank you. And yourself?
I'm doing well, thank you. Can you tell me a little bit about MSTEPP?
Yes. MSTEPP was founded in 2007 when it was established that the substance abuse epidemic in Mohave County was really out of control. Unfortunately, current indicators are telling us that it's even worse now. It was founded by a group of volunteers. We're all here because of our love for community and wanting to make a difference in the substance abuse issues within our communities.
Tell me a little bit about the goals of the program.
The initial goals were to work on providing a treatment facility for the county. As of right now, we don't have one. So people that are actively seeking treatment have to go either to Phoenix, Yuma, Prescott, Flagstaff, Las Vegas. We do have outpatient treatment available, but if you're somebody that is really plagued with a substance use disorder, the barriers to change in Mohave County are extreme.
Patricia, your website is mstepp.org. That's MSTEPP.org. How about a phone number where people can reach you?
928-754-4060.
And one more time.
928-754-4060. That's our hotline. She is more than willing to help you find a resource for what you need. As much of a problem as Mohave County has for substance abuse, we also have some amazing opportunities for recovery, the aftercare. You have to take that first step and be willing to say, I need help.
And that's it. We're out of time. Thanks to my guests, Dr. Sarah Knievel, Jaimie Valdivia, and Patricia Jacques. I'm T.G. LaFredo. Please join me again next Saturday at 11:30 a.m. for another edition of Focus on Your Health, right here on the KJazz Radio Network.